Hello, I'm Dr. Gerald Chodak, and this is prostatevideos.com. On October 14, 2009, an article was published in the Journal of the American Medical Association comparing minimally invasive radical prostatectomy to open radical prostatectomy. The headlines on several of the wire services claimed that the minimally invasive techniques were causing more impotence and more urinary incontinence. And so many people who have been thinking about how to have their prostatectomy done may now be questioning whether or not minimally invasive procedures are the best way to go. So, several points to make here. Number one, this study does not provide an opportunity to make any valid comparison about the long-term results of minimally invasive compared to open radical prostatectomy. This was a retrospective study. There is no way to know how experienced were the doctors performing the operation. We know nothing about the sexual and urinary function of the patients prior to their treatment. And there were no validated questionnaires used to tell exactly how patients were doing down the road from their operation. So, this study does not permit a valid analysis of minimally invasive versus open prostatectomy. And I think the viewers need to be aware of that when they're considering if they're going to have surgery performed, how to have it performed. By the same token, I think it's important for you to understand that the marketing campaigns and the highlights claiming that there are better results in terms of urinary control and sexual function with robotic surgery, those claims also are unfounded. The scientific literature does not permit us to say for sure that you do get better results. We do know that minimally invasive technique in robotic surgery will give you a slightly shorter hospital stay on average. It will give you less likely the need for a blood transfusion, and it will allow you to recover a little more quickly. And those, for many people, may be sufficiently desirable outcomes that they say that a robotic technique is worth doing. But don't take this procedure and don't seek out the procedure because you believe that it's clearly better for urinary and sexual function. At the present time, we lack the ability to make that claim as a valid claim. At this time, there is no way to say that there is a significant difference in the results in terms of those complications. And those complications are very important. You may ask yourself, well, why isn't that information available? Well, there hasn't been a great demand by the public. Certainly, if you're considering having a radical prostatectomy, there are certain questions you want to ask your doctor. How many of them do they perform? What are their own complication rates? How were those complication rates measured? Do they do validated questionnaires on their patients to be able to know how good is the sexual and urinary function down the road? And similarly, how good is the outcome in terms of cancer control? What proportion of the patients that are similar to your condition are ending up needing other therapy down the road? So hopefully you'll find this information useful to you and remind you that you need to be very cautious when looking at the headlines that appear in the media, in the newspapers, and on TV, because they tend to sensationalize results without critically analyzing them and telling the viewer what's good and bad about these findings, to allow you to say, this is something I can trust, or this is something that I can't trust. Hopefully you'll find this information useful. Thank you.